Brownstein's dachshund, Frank, greeted me at the door of what seemed more like a home business or a small .com than a doctor's office. The place was tastefully decorated with textiles and art, including a metal sculpture, a sort of Tin Man Tit Man, with long pointy rocket breasts standing in the corner like a sentinel. As I walked farther into the office, I caught a woman behind a computer singing to herself. The Nina, the Pinta, the Santa Maria. When she looked up, she noticed me. "Oh my, I'm so sorry," she said. "I'm so, so sorry." The assistant was blonde and reminded me of some kind of ist, a cosmetologist or a dental hygienist. I was curious if it was her general lack of professionalism that distressed her, or if she knew that calling attention to a feminine name, potentially a source of pain for someone seeking gender reassignment surgery, wasn't the smoothest move. "It's totally okay," I said. "I'm just so embarrassed." Really, it's okay. People have been saying that to me my whole life. As I spoke, suddenly aware that that may have been the final time I'd inspired that memorable string of ships, an unexpected sadness overwhelmed me. Now that I no longer felt constrained by how my decisions would impact my parents, I'd begun to consider changing my name. Although I've revisited every gender-neutral or masculine end name in the baby book, I had allegiance to Nick for popping up at a time when the boy in me was begging to be seen, if only by me, in my own mind. Lately I've been considering Nick, N-I-C, versus Nick, N-I-C-K. But my preference for the latter was more of a creative than a gendered interest. I liked the way my first and last names linked together with the double K. Thinking about a new name had been fun, except I hadn't fully realized that to take one on, I'd had to give up the word that had been closest to me for 30 years. When the it stopped apologizing, she sat on the other side of a solid wood desk and explained much of what I already knew about the surgery center, the 5 payment installments, and the series of follow-up appointments. She reminded me of a favorite aunt, an adult who didn't understand kid things, but whom you talked to instead of your mom. "Will you be transgendering?" she asked. I imagined this was her synonym for transition. But did she want to know if I'd be changing my name, switching to an M on my driver's license, taking testosterone, considering bottom surgery, if I used the men's or women's bathroom, or which dressing room I was sent into at a department store? "I'm not sure I know what you mean," I said. Oh, she said in that desperately apologetic tone of hers. "You don't have to get into it. I just need to note whether to refer to you as he or she at the center." I wanted to calm this flustered woman, tell her she was doing a fine job, and I felt safe and comfortable in the office. I also wanted to tell her that a simple pronoun query would suffice, and perhaps we could retire the term transgendering along with sex change operation. Instead, I told her she was fine. She asked if I had any questions, and I did, a whole sheet of them, all of which would have to wait for the doc. She pulled out a large appointment book and offered me a few dates in the middle and end of January. I asked if she had anything earlier. She flipped some pages, talking about how busy it was around the Christmas holidays with school breaks. "I could probably get you in on December 3rd, she said. Would you like that?" My stomach dropped out. That was less than 6 weeks away. "I'll have to check with Dr. Brownstein to see if he can squeeze you in." She barely glanced up from the book. As I waited to see if my nervousness would expand into reality-induced fear, an all-consuming excitement took over. That would be great. The assistant walked up to the loft and asked Brownstein, returning to say it was no problem, he would do 2 surgeries on the 3rd. Should I be concerned about being squeezed in for what I consider major surgery, I asked. "Not at all," she said. "He's the best." Any chance I could get the first appointment that day? I was only half kidding. Brownstein's shoes clanked as he came down the metal stairs. Tall and wiry, with a full head of distinguished red hair. He had smooth skin that made him appear younger than I'd expected. "This is what I tell people," he said. "If it's the first one of the day, I say I'm fresh. And if it's the second one, I tell them I'm all warmed up. I laughed. So it's not a problem, I asked, aware that what might have felt like putting him out was the equivalent of offering him $5,000 to work a few hours of overtime. How many do you do in a day? 3 was the most, he said. It was a rare circumstance. Everything went fine, no problems, but I won't do it again. Brownstein's told me he did 4 to 6 surgeries a week. I asked if he took enough vacation and whether he'd have a nice rest over Thanksgiving, since it was the week before my scheduled date. He assured me he rested and replaced his assistant behind the desk. I unfolded my yellow sheet of legal paper. Sometimes when I see guys running with their shirts off, their pecs bounce. Will my pecs bounce? Depends on your pecs, he said. I figure with my mammary tissue removed, I won't have breast soreness, but will I have PMS symptoms in my chest? I can't imagine how you could, he said, sounding slightly baffled. It's also not the kind of thing my patients would mention. Will losing more weight help my results? No. What if I have the surgery and then I gain a whole lot of weight? What will happen? I thought my chest might explode. It probably won't look so good. I figured he'd tell me to cool it with the absurd questions, but when I prompted him to shut me up, he only said, I've got time. I don't have any appointments for a while. I moved to nipple grafts, drains, how much assistance I need during my recovery, and ended with a fine print on the medical waiver. So about the blood clotting and this thrombosis, I said, what's the risk of me dying here? Bronstein stared at me solemnly, and I saw in his eyes that he never forgot the seriousness of what he did, bearing responsibility in the operating room while his patients slept peacefully. He reiterated his smooth track record, which covered a few decades and over 1,000 surgeries. There are always risks, he said. I don't think we need to talk about them. You're going to be just fine. He knocked on the wood desk. I trusted him completely. He looked over my form once more and focused on the question I had evaded about the therapist's letter. I knew from friends and blogs that he, chairman of the ethics committee for the World Professional Association for Transgender Health, didn't always require this letter, recommended in the association's guidelines for gender reassignment surgery. Do I have to? I asked. Can you? I can, I said. I prefer not to. I was paying $8,000 out of my own pocket. Health insurance wouldn't cover surgery. Why did I need a damn permission slip? I fought my urge to argue. I didn't want to piss off one of the few surgeons who could do this type of procedure. What does it have to say, I asked. I'm of sound mind to make an adult decision. That's it, nothing more. He assured me the letter would sit in some dusty file in the bottom of some dusty drawer. Fine, I aimed for a placating tone. We went around the divider to the only part of his office with anything sterile or medical. Brownstein sat in a plastic chair far from the exam table. He crossed his legs effeminately and waited. I pulled my shirt over my head, then my binder. I stood in the center of the room. Yep, I can do it, he said, remaining a few feet away. I asked him a question about the incisions and one of my birthmarks. He came closer and pointed to a few places on my chest, treating my breasts as I did, flesh to be excised. Relieved, I had my shirt back on in less than 5 minutes. Brownstein left his assistant to make my follow-up appointments. She was still shaken by the Christopher Columbus situation. It's such a pretty name, she said. Nina. Oh. Her last word echoed in my heart. I lingered on the sounds, traced the curves, had breakup sex with my name right there in the office, holding on as we moved in opposite directions. And it's quite popular these days, she said. Growing up, I didn't meet more than 1 or 2 people with my name. Now, I try to imagine elementary schools full of these small Ninas. I pictured them with long wavy hair pulled back into barrettes, pierced ears with rhinestone studs, beige corduroy pants with the cuffs rolled up. I pictured them as I was once, a little girl snuggled into a red peacoat, her father bending down to button it and squeezing her too tightly.